Hi parents, Dr. Pham here, pediatrician at Rainbow Kids Urgent Care, bringing you another MPP, but this time on middle ear infections, otherwise known as otitis media. Now we see a lot of this in the urgent care and we get plenty of antibiotics for it. But I want to take a little spin on the education here that's different than what you're going to find in most videos. And that's how we can prevent, hopefully, a middle ear infection, and or we can help speed up the recovery and clearance of middle ear infection. All of it centers around understanding how the middle ear drains. There's a tube known as the eustachian tube that drains your middle ear to the back part of your nose. This tube is highlighted here in yellow itself, and you can see it runs from the middle ear down to the back inferior part of your nose itself. If that tube gets blocked by either mucus or swollen tissue, allergic rhinitis, swollen stuff, then it won't drain well. The other thing in children, the eustachian tube runs horizontal, which means it does not have gravity to help drain it. As you get older and become adult, the eustachian tube is much more angulated, which allows it to drain more efficiently. This is why adults rarely get middle ear infections, but children get it all the time. So to be able to help prevent it, so middle ear infections typically occur after a child has a viral upper respiratory tract infection, gets a whole bunch of congestion, and then a week or so later, they start complaining of ear pain, have fevers, and then they get diagnosed with a middle ear infection. So to be able to prevent it or manage it once you do get it diagnosed is you have to focus on clearing the nose. If plumbing gets plugged, you have to flush it through, otherwise it will never get unplugged, and the middle ear and the infection will never go away. So 3 things that I recommend that are easy things you can get over the counter. 1, saline rinses. Rinse out the nose using something like a neti bottle and the saline that comes with it to help flush out that mucus. Second part is you want to decrease the acute swelling. So you can get over-the-counter Afrin spray and spray into the east nose. However, keep in mind you do not want to use it for more than 3 to 5 days per month, as you're going to rebound swelling that's significantly worse. How it works is that it constricts the blood vessels going to your nose and acutely decreases swelling. The third phase of it is that we recommend to some children, not all children, but predominantly those who have recurrent ear infections, is nasal steroids, such as Flonase, which you can get over the counter. When you do any of these nasal-based sprays, ensure to point and angle about 30 to 45 degrees and angle it away from the middle part of the nose towards the areas known as the nasal turbinates that actually get swollen. You don't want to angle it towards the middle as you'll get nosebleeds, but angle it towards the side at about a 30 to 45 degree angle and you'll be able to clear it. I guarantee if you do this, the recurrent ear infections will go down in your children, and the ability to clear them so that you don't have refractory ear infections where you have to keep changing antibiotics will improve. Now, unfortunately, with the very young children, they don't really tolerate nasal rinsing well, but definitely they can respond to Afrin to help decrease the swelling, and then you try as best as you can to suck out those boogers. Best of luck. Let's help our children, and let's help decrease the incidence of these middle ear infections. Bye. As always, call us with any questions or come by and see us. We're always here to help, and we're always staffed by a pediatrician.